We are very excited about the new physical rehabilitation room in the North Building. Physical therapists and rehab practitioners are assessors of movement. We love to watch our patients move. The larger footprint of the new rehab gym will allow us to be able to work up close and personal, but also take a little bit of a step back when we are assessing our patients' mobility during evaluations, reassessments, and also during their treatment sessions. This is one of our devices and modalities in rehabilitation. It's called the underwater treadmill. It's a great modality that we can utilize for a lot of reasons. You can utilize it for patients that have to be unweighted after surgery. Maybe if they have osteoarthritis or overweight, the buoyancy can be very helpful to help their mobility. It's also nice warm water and provides resistance. And we can use our system here to fill up to the goal of the water height. And depending on how or what our goals are, like buoyancy, what movement we want to utilize. So let's say our patient is walking with a limp and we want them to go through a bigger movement. We might have the water to their knee or above their knee so they can utilize more of their gait range of motion. So this can be used for very small dogs, large dogs. It just really varies what our goals are. It can be very helpful in a comprehensive rehab plan to safely exercise them in a buoyant, warm water environment. So this is our dog pacer. It's a land treadmill, obviously, versus our underwater treadmill. So this can be a really nice modality for patients to exercise on because we can change the incline-decline to work on their stride. I'm usually on here, straddling this, of course. The dog is facing here, so I'll use little Onyx here from the police force. There he goes. And we are having the dog put their head here, and then we are hanging on to them initially until they're safe on here and they're able to go through some nice walking paces at a consistent speed and then duration that we want. So most dogs when they're walking are sniffing and starting and stopping, and what's nice about this is that we can really regulate the time, the consistency, the safeness, and actually take some videos of them from the front and the back and on the side too. We can take off these little panels that we're able to document their progress throughout their rehabilitation. All right, so this is our land ramp, if you will. Right now we have it we don't have a lot of space, so we have it against our wall here. And what's going to be nice in our new room is that all of this equipment can be above and give us a lot more space to be evaluating, reassessing, and working with our patients. Why would we use a ramp? Lots of different ways. Actually going up and down a ramp can be really helpful. When you think about going up a hill, you're going to be kind of pushing back with your back leg, so you're really using like your butt muscles, your hamstrings, your gastrocs. You're utilizing your front legs very differently with your rotator cuff and your biceps, so you can work on up and down and the reverse on the way down, especially if you're thinking about an animal. They're going to be shifting a lot more weight forward, and they're going to get more control and activity of their muscles descending a decline. We can be working on different static exercises, so maybe things that we would do on the flat floor we might do on an incline to get them to shift weight back. We might use a balance board, so we have some uneven surface area here that I control, so we can elevate his front limbs, put his back limbs down here, and be wobbling this board to do some exercise for his core, for his hind limb strengthening, maybe offload the front if we need to. So we can be very creative in rehab to figure out what is the goal of every patient, what they need, and how can we be creative and make things realistic also at home for clients to do and families to do to execute the exercises to make them very strong and balanced and ready to go for all the mobility things that they enjoy.